Hi guys, this is Laura Cartwright. I'm sending this video out to all of you because we are in our survey window and I want to talk to you a little bit about some things that we've seen out on the floor and a bunch of different stuff that's been going on. So this is our prep for 2019. So the first thing I want to talk about is what happens if a surveyor interviews you. So now that can be a scary process. It's a stranger coming into your building and they're asking all these questions, but just know that it's a totally normal part of the survey process for surveyors to interview staff. If a surveyor asks you a question and you know the answer to it, that's wonderful. We just want you to answer them swiftly and only give the answer to the question that they asked. They will be writing down everything that you're saying. That's totally normal for them to do that. So the less that you say, the less chance of saying the wrong thing or getting your words misinterpreted. So if they ask you, how do you know how this person transfers? You can say, it's on my CNA assignment sheet. Easy peasy, you don't have to go into too much detail. If a surveyor asks you a question you don't know the answer to it, don't ever guess. Oh, I think that they transfer this way, because then it doesn't look like we know anything about our residents. So you want to tell the surveyor that you just reviewed that topic, or you'd like to refer to your education, or you'd like to refer to your supervisor, so that you don't get confused or that you don't give them incorrect information. So if you don't know, it's okay to say, I know the answer to that, but I just want to check. So typically surveyors are trying to do one of two things. They're either trying to understand a process of how things work within our facility, or they're attempting to gather an interview from staff that validates something wrong that they think they observed. So it's one of two things. So they're either trying to understand why we do things the way we do them, or they've seen something that they think may be incorrect and they want you to validate that it may or may not be incorrect. Just be honest. And like I said, if you know the answer, just be swift. You are allowed to have someone with you when you are interviewed, but that person can't talk during your interview. So you can ask that your nurse manager be present or the DON, but they just can't. They can be with you, but they can't say anything. So these following issues were discovered during mock survey, during the different competencies we did for nurses and CNAs, and just by management staff that have been throughout the building. Just so you kind of know what's going on behind the scenes, our management team have been interviewing residents. We have been doing observations on the floor, watching MedPass, watching dressing changes, watching CNA care, all kinds of things, just to kind of see what a surveyor might see. So this whole list here is stuff that we have sort of flagged as things that are opportunities for us to work on. So we're gonna go through each one pretty quickly, just so you get an idea of what we're talking about. So the first one, always provide privacy and knock before you enter a resident's room. I personally have seen this. I know we get busy, we kind of get in a hurry, or maybe we've already been in there a couple times today and we just kind of walk right into their room. We really need to knock before we go in and get permission to enter. It is their home, and all of our residents do have a right to privacy and dignity. Especially when you're providing care, privacy is extremely important. Anytime there's a risk that the resident could be exposed, so dressing, bathing, toileting, we're doing a dressing change, or if they're having like a private conversation, we have to have complete privacy for that. You wouldn't want someone seeing you, on the toilet or getting your dressing changed or talking about your medical care. It's really important that we keep that private. So dining practices have kind of really been very heavily looked at. So we got input from some of our nursing staff, our CNAs, dietary staff. We kind of came together and changed some of the dining practices. So we've had lots of education on this, but I just want to talk about the hot stuff. So house-wide, hand hygiene has to be performed between each plate or each tray pass every single time, no matter what. If your hands are visibly soiled, we're going to wash them with soap and water. Otherwise, you can use your hand sanitizer. Just make sure you're holding plates on the outside rim of the plate. Don't touch any, try to keep your thumbs off the plate as much as you can, and don't touch the top of the cups. Anywhere someone's going to put their mouth or could potentially transfer over. We don't want to touch any part of that. We want to keep the tray cart doors closed when we're not using them, so when they deliver trays up on the unit, that's going to help us keep that food warmer so we don't hear complaints of cold food. Once you pull a tray off of the cart, you can't put it back. That's an infection control risk. So always make sure that the person who you're giving that tray to is ready for that tray at that time. We don't touch any food with our bare hands. I haven't really seen that here, but it's just a reminder. So if you have like a roll that you need to butter, we're gonna use the fork and knife and kind of hold it in place that way. We always sit down when we're assisting a resident to eat. I haven't really seen an issue with that either. That's another reminder. We want to hold appropriate conversations that engage the residents. So I know that it's like a very common area and everybody's kind of hanging out. We can't have our headphones on. We can't have our cell phones out. That's disrespectful. If you went to a restaurant and your waiter was on their cell phone, you would think that that was disrespectful. So we can't do that here. This is supposed to be their dining experience. And the more conversation you hold with them, the more they will enjoy their dining experience. Cheers specifically has had some changes. You may have seen some changes to the drink station in the back. Some shelves have gone up to make it a little bit more organized. And then a partition is in place back there as well. There's a sign that's been placed so no one's allowed behind the counter if food is being served. And keep that in mind. So unless you're serving food, unless they're a dietary person, you're not allowed behind there for any reason. That includes our visitors and our residents. No one is allowed back there. We're starting to offer lids with coffee, and then we're gonna pour coffee at the table to avoid splashing. And then at breakfast, because it's kind of first come, first serve, in between each person, we're gonna wipe down the area after that person finishes eating and set it up for a new person because we don't do assigned seating. The next thing is informing a resident prior to providing care. So we always have to let someone know what we're about to do before we do it. So if you think of it from their perspective, if you're sitting in a wheelchair and somebody just comes up from behind you and starts pushing you and doesn't tell you anything, that could be a scary shock to your system. So we would just say, I'm gonna take you down to breakfast. We don't just start pushing them in their wheelchair. For nurses, you always want to let them know what kind of medications you're giving them, but you can be generic. You don't have to say, I'm giving you some long name of a prescription. You can just say, I have your pain pill or I have your blood pressure medication. But just let them know what they're getting. Meal take and fluid intake. So back during CNA competency, there was a lot of confusion about how much fluid is in each of our different cups that we offer. So up by all the kiosks, I've hung this little input documentation sign just to kind of help you guys out so that you can know. So if you ever need a question, you can always use that as a reference. We always want to make sure, CNAs, that our blue lights are off at the end of our shift, even if you're just charting 0. So maybe they didn't drink anything. We can't leave that light on. That light needs to go out. We need to chart 0. We changed matrix. Tracy went in and now everybody has the ability, every meal there is going to light up blue for fluids and meal intake and all of their snacks. So that's a lot easier. We're not missing it as often. So we've seen a lot of improvement in that, but really just always remember to make sure your lights are out. This came up during mock survey, just for my nurses. If you're giving any sub-Q administration, this is the main things that were kind of missed. We always perform hand hygiene prior to giving. You want to alcohol swab the skin, but you want to wait for it to dry. Alcohol, it won't really, it's going to sting for starters if you don't wait for it to dry, and it's not really serving its purpose until it is dry. We always pinch the skin. And just remember, if it's a multi-use pin, to wipe it down before you put it back on your med cart because it's been in someone's room, it has a needle in it, it's been exposed to a blood area, so we want to wipe it down with the Sani wipes. Expired drugs and supplies, biologicals. So Kim sent out a video a couple days ago about med cart audits, and those started today. And if you haven't seen that video, if you're a nurse, then you'll need to view that. Just remember that if you open something, date it. MedPass, eye drops, anything that you open, we need to make sure you date it. Always check your expiration dates on your medication and your supplies to make sure that it's appropriate. Some medications expire after a set amount of days after they're open, so like eye drops. You'll need to pull those meds once they're expired. And then we're in the process of making signs that will go on your carts to remind you of when to discard. So like eye drops have to be open for so many days. It'll be a list on your cart. Refrigerator log temperatures. We keep our medications, some of them, in refrigerators, and it's really important that they stay the right temperature. They could not work appropriately. So we have been seeing on the MedFridge sheets, there's holes where people have not filled it in. We always want to make sure it's within the appropriate range too. So if the sheet says 36 to 42 degrees, but the thermometer says 32 degrees, then it's too cold. So we need to let maintenance know, and maybe we need to adjust the refrigerator because those medications aren't being kept at the right temperature. Medications have been seen at bedside without an order. I have had people come up to me, and I've seen it in the nurses' stations where they found that things in residents' rooms. It's not uncommon. You know, they tell their family member, oh, I've been coughing, so they bring them in some cough syrup. It's totally something that happens, but if that happens, we always want to make sure it's not in their room. All medications need to be locked in the med cart unless for some reason they have an order on their care plan that they may keep it at bedside. If you see medication in a room and it's not something that we've care planned, we need to let them know that we have to remove it, and then we're going to let, if you're a CNA, let your nurse know. If you're a nurse, let the physician know that that person's been taking that medication. It could cause an issue with other meds they're taking, or they could be having side effects from it, so we just need to make sure that we're keeping track of that. Medication carts unlocked. Always, 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 always lock your med carts and your treatment carts. Even if you're walking away for just a second, even if you're kind of in the area, it's a really easy thing for surveyors to get you for. It's a really easy thing for them to observe, and it can actually be a potential harm for the residents. It's not for nothing. I have made several observations, just me personally, on every single unit where there have been med carts unlocked. So it's a bad habit to get into. So if you as soon as you're done, make sure you're locking your cart. Shared equipment. We want to wipe down shared equipment between residents every single time we use them. So if I use a mechanical lift, I want to wipe it down after I'm done using it. If I use a shower chair, I need to wipe it down before I put somebody else in that shower chair. A stethoscope, a blood pressure cuff, anything where I go from one person to another person, I have to wipe it down every time. Because if resident A has a cold, and then I use a blood pressure cuff on them, and then I go to resident B, I've just spread germs from one resident to the other because I didn't bother to clean it off in between. So we use several different products, and I want to kind of briefly talk about what each one is used for. So the far left one that you see there, the blue one, Sani Hands. We can use that on skin, you can use it on the lifts, you can use it in the dining room. It's safe. It's just like hand sanitizer. It's going to not do anything to harm you. It can be out in common areas, and it dries instantly. The purple one, it's a little taller. Those are Sani cloths. They are not safe for use on the skin. They cannot be out in common areas. They clean and disinfect, and they take 2 minutes to dry. So we would use that on shared equipment that involves blood. PT-INR machines, blood glucose machines, IV poles, things where blood or anything that we would want to kill a little stronger would be involved. The final one, the orangish brown colored one, those are bleach wipes. Of course, those are not safe on the skin. They cannot be out in common areas. They take 4 minutes to dry, and they are corrosive to metal. So we want to limit the use that we use those on anything metal. We would use those in like a norovirus room or a C. diff room, anything like that, because that's all that would be able to kill that. Hand hygiene. This is house-wide. It's just, we would always be thinking about whether your hands are clean or not. So when would we wash our hands? Before you provide care, before you do clean procedures, after you're exposed to bodily fluids, after you take off any pair of gloves, after touching a resident or their surroundings, in between resident plates or trays, and whenever you think they're soiled. how long, and surveyors will time you, so make sure you're doing a thorough job, and they will ask you how long you're supposed to wash your hands. So you can either say 20 seconds or sing happy birthday song twice is a common one. They will accept both of those answers. Hand sanitizer versus hand washing. So hand sanitizing, as long as your hands are not visibly soiled. So if I just went in a room, I turned off someone's call light, I gave them a cup of water, I took my gloves off, I can just hand sanitize. That's not a big deal. But the thing about hand sanitizer is it has to be dry for it to be effective. No gloves in the hallway. Nazareth home policy is no gloves in the hallway, no matter what. So when you remove garbage from a room, you tie it off in a knot. If you hold the garbage bag by the knot and then remove your glove down over the knot, then you can carry it out into the hallway and then drop it in the 3-bin compartment and then just go wash your hands after that. In the dining room, the only person that's allowed to wear gloves is the person removing and scraping plates. And that person has to be really making sure that they're not touching anything else. If they do, they have to remove their gloves and perform hand hygiene before they do any other task. Call light response time came up during mock survey and during resident interviews. So call light should be answered in a timely manner, but we do understand that staff are unable to get to the call light because they're assisting someone else or they're in the dining room or something. And that's why teamwork is so important. So all staff should be answering call lights when they see them on. On Spalding Square, a sheet containing all the residents' transfer statuses is now on the front of the CNA assignment sheets that they have, so they can safely assist someone outside of their group. And that's being worked on for charity court and rehab. But if you can help with whatever it is, sometimes it's not even a transfer. They just want some water, or they just want to know when mass is, a question. That's an easy call light we can all grab. This one's for nurses and has to do with dressing changes. So Stephanie and I have both been observing dressing changes over the past couple weeks. Hand hygiene and glove changing is not being done appropriately all the time. We're planning on doing a separate training for nurses specifically to dressing changes, probably like a huddle up on the units. But the big things I want to remind you are, we always need to thoroughly read the order. Dressing changes are being changed, or dressing orders are being changed all the time. Dr. McMillan rounds, they make subtle changes. You always want to make sure you're actually following the physician's order. And if you have questions about the order, then we would need to call and get clarification. Because sometimes they can be complicated and you want to make sure you're doing exactly what they want you to do. Always put down a barrier for your supplies. So we pull our supplies from a cart, we can't go throw it on a dirty table or on their bed or any area like that. We need to really be cautious that we're putting everything and keeping it all in a nice clean area. So a barrier can be a paper towel, it can be a towel, it can be anything that you grab, but just have a barrier down for your supplies to go on. So you need to wash your hands and put on gloves before you remove the old bandage. And then you need to wash your hands and put on gloves after you remove the old bandage. We need to make sure that that old bandage doesn't touch anything. So that old bandage has been up against a wound, so it's got whatever that wound is giving out, blood, pus, anything like that. So it's dirty, it's very dirty. So we want to pull it off and make sure it doesn't touch anything. The best process is to really pull it off and fold it in on itself. Or just kind of tape it up. Unless it's a wet to dry dressing or we're doing some sort of debriding, we want to moisten that bandage before we remove it so that we're not re-injuring the skin. So another reason to check your orders and question if you have any questions about what that order might be. And then we want to wash our hands after we clean the wound and put on new gloves. And then we want to do hand hygiene after we are completely done with everything. The last thing I want to talk about is abuse, neglect, and safety. So on your badges on the back, you should have the different types of abuse. Surveyors may ask you that. You are 100% fine to use that as a reference. Pull it out. They may ask you what the different types of abuse are or give me an example of this type of abuse. So we'll go through those really quick. The different types are listed over on the left. You have verbal, that would be someone cursing or yelling or intimidating someone. Physical would be physically hitting or kicking or pinching or biting someone. Sexuals, any unwanted sexual physical contact. It could also be sexual inappropriate conversation, sexual imagery. Mental or emotional would be ridiculing, insulting, making somebody feel guilty. Involuntary seclusion would be confining or isolating someone against their wishes. Misappropriation of property would be taking or using someone's belongings or money without their consent. And neglect would be denying care to somebody who depends on us. So if someone depends on us for bathing, if we're not giving them baths and they would like baths, then we would be neglecting them. All allegations of abuse have to be reported within 2 hours to state agencies, but you need to be reporting them immediately. So one of the questions a surveyor may ask you is, who would you report abuse to? So if you're a CNA, you would just say, I would report it to my nurse. If you are a nurse, you'd say, I'd report it to my manager. And then the process goes on and up from there. The last thing I want to talk about is safety. So the biggest part of safety that I want to talk about is how important it is to always, always, always follow the care plan, your CNA assignment sheets, and the physician's orders. That is what surveyors are looking for. They get all that paperwork. So when you see surveyors coming, they're going to be asking for pages and pages of documentation. They're asking for care plans, CNA assignment sheets, and physician's orders. And then they want to watch what you're doing. So if you're not following the CNA assignment sheet or the care plan or the MD order, then that's a tag. But not just because it's a tag, but we should be doing that because it's what's safe for the resident. A lot of time and effort goes into the devices that residents use to transfer their wheelchairs, their walkers. All of the equipment that they use is heavily looked into by the nursing staff, the therapy staff, the physicians, to make sure that it's the safest and most independent that a resident can be. So just always keep that in mind. We can't just choose on our own how we want to transfer somebody. It's not written on here, but just always remember, gate belts are your friends. That you always have that extra piece there in case someone were to fall. If you always wrap a gate belt around someone, it's your line of defense. So if someone falls while you're trying to transfer them or something, you always have that gate belt to grab onto. The last 3 things, we can't prop open any doors. That's a life safety code violation. So any door that's weighted and closes on its own, we need to make sure that those doors are closed. We cannot put anything in there to prop them open. No items are allowed out on the handrails, like boxes of gloves is probably the most common thing that I see. And I totally understand how they land there. It's a very nice little landing spot, but it is a life safety code violation because it is a means of someone to transfer down the hallway, and if something was obstructing them, they could fall. Last thing, no chemicals out on the floor in resident rooms or in common areas. So we just talked about those different chemicals, the bleach wipes and the Sani wipes and the hand sanitizer wipes. So the hand sanitizer wipes are the only ones that are allowed out on the floor, the blue ones. That is it. Everything else needs to be back in a utility room or in a locked area, nurse's station, inside the nurse's med cart, somewhere where a resident could not access it. That is it. I will be rounding around the next couple of weeks. If you all have any questions, just let me know. All right, thanks so much.